So good afternoon, everybody. Let me do a quick update on testing and cases, and then we'll get into some other issues. Yesterday, the Department of Public Health reported 1,166 new cases. A little over 29,000 tests were reported, and over 8.4 million tests have been conducted since this started. The 7-day average positivity rate is about 3.9%. There are 1,174 individuals in the hospital being treated for COVID, and about 244 are in the ICU. Across the country, states have been reporting increased cases and increased hospitalizations now since Labor Day. The surge was predicted as summer wound down and as people began to spend more time inside. And in the Commonwealth, COVID infections also began to increase rapidly in October. In response, about 3 weeks ago, we made a decision to renew our stay-at-home advisory and ask people to go to work and school and stay home whenever they could. We also ordered early closures of retail, restaurants, indoor recreation, and other businesses where people can gather for long periods of time to cut down on the places and the times where COVID could spread. And over the last 10 days, new case growth has, in fact, slowed down. Also, over the last 10 days, Massachusetts' positive test rate has stayed just under 4%. At the same time, we recorded some of the biggest days of total tests administered since we began testing. We continue to lead the nation as a tester, but the volume of tests the testing sites processed surpassed all of our previous high water marks. And while it's only 10 days, the slower case growth and steadier positive rates are an improvement compared to the sharp increases that we saw the few weeks before that. Didn't happen by accident, and I'm asking everyone to continue to do their part to slow the spread. As we've said before, hospitalizations have been steadily increasing, which is not surprising given the rise in cases, and on average, hospitalizations have been growing at about 2.5% per day for the last couple of weeks. Make no mistake, there's still community transmission of COVID-19 in every part of Massachusetts. Thousands of people are contracting and possibly spreading the virus, and people are being sent to and cared for at our state's hospitals. And every day, the number of people in Massachusetts who become unable to breathe on their own end up in an ICU. And while far less common, too many of our fellow residents are losing their lives to COVID as they did in the spring and throughout the summer. I think we all know that especially at this time of year, it's hard to stay home and avoid groups and get tested and keep your distance, but those are the things we need to do to continue to stop the virus. Everybody has to keep doing these things because we know that they work, and the idea here is to keep everybody healthy and to keep our schools and our economy going forward. Certainly fair to say that with all the work that's been going on around vaccines and other issues, there is a light at the end of the tunnel. But that's all the more reason at this point in time, as we head into the holidays, to dig a little deeper and continue to make the difficult choices that the vaccine and the times require. There's also been a lot of misinformation going around about things that are going to get shut down here, there, everywhere at a moment's notice. People have enough stress in their lives without having to deal with the rumor mongering. Remember to get your information about what's going on statewide from verified sources like mass.gov or from media organizations. This may come as a surprise, but the guy your sister knows who used to work with a guy who knew your friend, they aren't necessarily up to speed, up to date, or accurate with what they know about what we and others are up to. At this time, the Commonwealth is not planning any additional closures or restrictions. We'll continue to follow closely the public health data and continue to make decisions based on that. The public will be given, as they have been in almost every instance and circumstance since the beginning of this, clear notice before anything new goes into effect. We do believe that there are brighter days ahead, particularly as we await the movement with respect to the development and approval of a number of vaccines, which is encouraging news, But in the meantime, we still need to do the things that so many people in Massachusetts have been doing and doing well for the past 10 months. I do believe if we continue to do those things, we can fight off this insidious virus and get through the holidays. Now, speaking of the holidays, I do want to talk a little bit about houses of worship. The COVID Command Center, as most people know, publicly reports robust data on COVID spread, giving residents, the media, researchers, and local officials and state officials detailed information on what's up with the virus. We've been refining this data throughout the pandemic to help inform our response to COVID. In October, DPH began including a weekly cluster report and has a team of dedicated epidemiologists who work to track and analyze them. This team has found that most of our cases arise from household spread and informal gatherings where people are letting down their guard, particularly when they're with people they know. But there are other sources of spread as well. We recently discussed youth hockey and several other establishments that have been linked to COVID-19 outbreaks. When we detect possible patterns like this, we deploy that team of epidemiologists to do a deep dive into the data. The team recently completed a close analysis of clusters from places of worship after local boards of health reported several outbreaks occurring in communities around Massachusetts. Now, we know that houses of worship have always served as a place of refuge, especially in difficult times like this. And I remember way back when in March, when we first started talking about our original stay-at-home advisory, how difficult it was for the Lieutenant Governor and me to include places of worship as part of those decisions. And during this time especially, as we head into this holiday season of faith and hope, houses of worship play an enormously strong and important role in many communities and in the lives of individuals and families across the Commonwealth. But as with all gatherings, protocols have been put in place to ensure that services and other functions that happen in houses of worship happen as safely as possible. And the Commonwealth's faith leaders have responded admirably to the COVID-19 pandemic. Many have moved their services online, allowing members to still tune in every week and from the safety of their home. Some have adapted to holding outdoor services or added partitions to listen to services from their vehicle in the parking lot outside. But our data still found that there were too many clusters of cases that stemmed from houses of worship, and these cases spread out into the community at large. Since the start of COVID-19, houses of worship have experienced a total of 36 clusters. Those clusters have led to 316 confirmed cases and 150 total close contacts. 48 Massachusetts cities and towns have had one or more confirmed or probable COVID cases associated with a place of worship cluster event. That by itself is pretty extensive. In the last month alone, places of worship saw 6 clusters with 44 confirmed cases and 22 close contacts. In one of these clusters, contact tracers reported over 200 positive cases. That's obviously a big number, but what's more concerning is that those 200 individuals went off into their own daily routines where they were likely exposed to numerous contacts in different settings. As we've said many times before, one of the most dangerous aspects of COVID-19 is its ability to silently spread from person to person across groups, especially if people are engaged in informal conversation without masks or distance, and in many cases with no symptoms, the so-called silent spread. Contact tracing helps us follow the data to get a picture of how far this virus can reach. In this particular case, about 90 businesses and organizations were exposed as a result of those original cases, and possibly more. Of those 90 organizations, 23 then had clusters of their own arise. That cluster led to over 40 cases at a local university, which came through 2 different chains of contact from 2 attendees at that house of worship. We all know that COVID is contagious, and we all know data like this shows just how quickly a cluster can spread, infect others, and create other clusters. For many reasons, from holidays to funerals to weddings, houses of worship are often the setting for group gatherings, as they should be, have been, and will be. But this holiday season is special for many religious organizations, and they have many additional services and community gatherings, as they always do. Most families have long-standing traditions anchored around their church, their mosque, their synagogue. But we know that this year, it should and will look and feel different due to COVID. And we continue to ask all of our faith leaders and residents who practice to engage in safe policies, protocols, and procedures. Many have moved remotely, as I said before, and that's certainly positive. But I think it's critically important, if you do attend an in-person service, please do wear a mask, keep your distance. Remember that in-person gatherings, especially indoors, have an increased risk for COVID spread. If you're hosting an event, like a wedding, please consider keeping your group small to avoid the risk of transmission and follow the rest of the rules. We know that it's difficult to ask people to modify these time-honored traditions, but COVID has no intention of taking the holiday off, and in many respects, it's many of those time-honored traditions that create some of the most significant issues with respect to spread. Now, we talked a lot about this before the Thanksgiving Day holiday. And the Lieutenant Governor and I and Secretary Sutters were pleased to see that airline travel year over year was down about 60%. Bus and train travel over the weekend was down about 80%. And automobile travel was down about 5 to 8%. Now, we weren't pleased about that because we thought it meant everybody had a great holiday. We were pleased by it because it meant that many people understood that this year, that Thanksgiving Day event, that Thanksgiving weekend needed to be different. We also heard from many of the folks who sell turkeys that the small birds went fast, and in many cases they had big birds left over. Another indicator that people did smaller gatherings than they have historically in response to COVID and to the messaging that came from so many of us. Now, I get that after 10 months of fear and anxiety and tragedy and sacrifice and uncertainty, as we head into this holiday season, the one place most people want to be, for very good reasons, is with their family, participating in many of those rituals which involve formal and in some cases informal gatherings that we all love so much. And what we're really saying more than anything to people is recognize and understand that if you're going to get together with people you don't normally spend time with, be safe. Wear the mask. Encourage them to wear the mask. Keep your distance. Wash your hands. Don't share food and beverage. And treat it a little more formally than you might normally. This isn't, hopefully, a forever thing. But when you're in the midst of the kind of surge that we and so many other folks around the country are in, it's important for people to keep their guard up in almost every social circumstance and situation, no matter how valuable and important that particular gathering or that ritual can be for you or for members of your family. I also want to give a quick update on some new supports we're providing for long-term care and nursing homes. As COVID-19 cases rise across the state, we've seen an increase in clusters at long-term care facilities. Since the spring, we've implemented accountability measures and provided significant support to this community. That's included over $400 million in additional funding, rapid response teams to provide staffing support, state-funded surveillance testing for staff and residents, PPE, and regular infection control surveys. Facilities are currently in a far better position to respond to COVID-19 now than they were in the spring. And that's illustrated in many respects by the fact that in the spring, folks over the age of 70 represented about 20 to 30% of all of our positive COVID cases. They've represented about 8% since Labor Day, and that number hasn't moved hardly at all. However, with the new outbreaks and the growth in cases overall, we have seen an increasing number of facilities requiring temporary urgent staffing support due to staff testing positive for COVID. To help with these staffing shortages, we'll increase the number of rapid response teams that are available to support long-term care facilities from the 8 we currently have on the ground to 14. Each rapid response team includes, on average, 10 clinical staff that can support direct care, infection control management, and PPE coaching. These additional 6 teams will be available by mid-December, and in the meantime, the Massachusetts National Guard will serve as a bridge to provide clinical staffing supports to facilities with urgent issues and concerns. About 80 members of the Guard are ready to be deployed by the end of this week. And all of those members of the National Guard teams have clinical training. 2 Guard teams will be deployed to 2 nursing homes early this week and to support direct care staff. The National Guard will provide supports through at least the end of December, and will reassess the long-term care facility needs at that point in time. And as we have seen demand for rapid response teams shift over the course of the year, we've adjusted the number of teams available to provide these supports, and will continue to ensure that these supports are available for facilities that have the biggest concerns and greatest need. At this point, I want to give Secretary Sutters a chance to talk about some supports for individuals who need a safe space to recover from COVID. Thank you.
Governor, Lieutenant Governor, good afternoon, everyone. I hope you had a safe and healthy Thanksgiving. Since the beginning of the pandemic, the Commonwealth has established a network of hotels to provide a safe and therapeutic space for isolation and recovery for residents who test positive for COVID-19, but are in a housing situation where they cannot safely isolate. For example, homeless residents, people who live in group housing, residents who live with someone who is at high risk of COVID and cannot safely isolate. In the spring, as some of you may remember, we opened 5 isolation recovery sites who've served to date more than 900 individuals. Residents from throughout the state have been provided these services from Boston to Pittsfield. And even as the need vastly decreased over the course of the summer, we maintained the Everett location over the course throughout the summer and through the fall. As we weather the second surge, we opened a location last week in Taunton and have secured a second location in Pittsfield that will be ready next week. At this moment in time, we have the capacity to serve a total of 256 individuals, and by next week, the capacity will increase to 351. Over the weekend, the 2 existing sites, the one in Everett and Taunton, serve 122 people. MEMA provides the supplies, meals, security, intake, general staffing, and transportation to and from the site. These sites serve individuals who are homeless or housing insecure under 400% of the federal poverty level. The Command Center works with the Commonwealth Care Alliance and clinical partners to provide medical and behavioral health services, up to and including pharmacy. We continue to monitor the demand for isolation support closely, and we're prepared to launch additional sites as the demand increases. And future site decisions will take into account, obviously, the geographic diversity of the Commonwealth. With that, I'll turn it back to the Governor. Thank you.
Questions?
Governor, there are restrictions when you go to church. Are you asking people, for clarity's sake, not to go to church?
No, I think what we're referring to is how important it is for people to abide by the guidance with respect to distancing, family pods, and face coverings, and no before or after coffee hours when they go to church, or to whatever house of worship they practice in. And as I said in my remarks, the vast majority of both parishioners and clergy have done a remarkable job with respect to this from the beginning. But we have had incidents and circumstances in which people haven't followed the rules or the guidance as part of their regular services, which has led to certain clusters. And the probably biggest and most well-known of these events was Crossroads in Fitchburg, which was not only an issue associated with church, but was an issue associated with the fact that the building was being used for many non-church related activities, and most of the time the folks who were involved in those activities did not follow any of the guidance or any of the rules associated with distancing, masks, head count, the rest. And those are the things we worry about the most.
So it's the places that aren't following these mask wearing and distancing guidelines.
Yeah, the big message here is if you go to a midnight service, right? A lot of people in Massachusetts do. Wear a mask, stay with your family, don't go to a before or after gathering. Treat it the way you would treat it if it were any other formal activity that was consistent with the kinds of things that you've been accustomed to in other settings over the course of the past 10 months.
Governor, would you agree that due to the Supreme Court ruling last week regarding New York and Governor Cuomo's limits on the number of people going to services, if that's off the table, you can't really tell a church, you have to limit the crowd?
So, I mean, every court decision obviously is different, but I think the way we would interpret the Supreme Court's decision on New York was that New York had one set of standards for formal gatherings generally, and then a different set of standards for religious institutions. Our rules, for the most part, around distance and around capacity are the same, whether you're in a church or synagogue or temple or another form of gathering space, a hotel or a meeting place. And I think our view is that as long as you don't treat houses of worship differently than you treat other organizations with respect to the rules associated with occupancy levels and distancing and face coverings and all the rest, we believe that's consistent with that decision.
Governor, officials out on the Cape and in Western Mass claim that they're basically a testing desert. Any plans to add more testing sites there, especially with the lines we're expecting with the holidays?
I guess what I would say is that we are currently taking a look at, there are 250 sites in Massachusetts where people can get tested, maybe even 270. There are about 17 or 18 Stop the Spread sites, which were set up originally in places where we had the highest and most significant case counts and the greatest risks. I think we are currently in the process of doing two things. Number one, figuring out what we think our distribution of testing capacity needs to look like, given the changing nature of where cases have gone around the Commonwealth. And then the second is recognizing and understanding that winter's coming. We may need some capacity to ensure that the testing sites that we do have can survive, snowstorms and super cold weather and a lot of the things that we really haven't had to deal with since we put these up last spring.
Any thought to utilize?
Talk a little bit more about, I know you submitted your plan for the vaccine distribution. Obviously, it could be up for modifications as we hear more from CDC later today. Realistically, what's going to happen when it starts getting distributed as far as when people will start to see that normalcy? I know that it's a moving target, but what will you be looking at? Similar to what we're doing without the vaccine? As far as what, keeping things closed based on the health data, or will you look for a population, percentage being vaccinated?
I'll say a couple things about this, and then I'll turn it over to Secretary Sutters. The way this process with respect to vaccines has worked is the federal government set up a framework, and then based on that framework, had states submit both distribution policies, acceptance policies, processes for determining how they would be distributed, where they would be distributed, and then basically looked at what they got from all the states and said, based on what we got from you, here are some additional things we'd like you to comment on, and some places we'd like you to go deeper, and that final submission is due Friday, right? Now, the feds told us yesterday on the call that I was on that we should expect to see vaccine distributed sometime in mid-December, that they would begin the distribution process for Pfizer sometime in mid-December, and the Moderna would probably start to be distributed shortly after that. AstraZeneca is still working through their clinical trials, and so is Johnson & Johnson. Beyond that, it's hard to say much more at a detail level until we actually submit our proposal, and our final proposal, I guess is a better way to put it, and we get some additional guidance from them the beginning of next week.
So basically, the problem has to go away, but then we can start returning to normal. I mean, that's, and then people are hearing the vaccine's coming, we should be able to start making plans, but basically we have to see what it does to the number.
Well, so with respect to the vaccine generally, there's a couple things people should keep in mind. The first is several of these are 2-dose vaccines, right? Some of them are 1 dose. The J&J one, which is still going through a 60,000 person clinical trial, is a one dose. Both Moderna and Pfizer are 2 doses, and those 2 doses are supposed to be sort of 3 or 4 weeks apart. So if you were somebody who got dosed because you were in a high-risk role, senior citizen in a nursing home, healthcare worker, high-risk community, whatever it might be, you would get 1 dose, and then you would be scheduled for a 2nd dose that would come 3 or 4 weeks later. So the thing to remember here is, even as the feds get into the business of following through on the distribution program that's attached to this, it's going to take a while before people would literally start finishing the vaccine process itself and start to generate antibodies. So the way I've thought about it is the focus early on, both here and in other places around the country, is going to be high-risk individuals to begin with, as the place people are going to go first, and that's probably going to be where most of the activity is in December, January, February, and March. That's really going to be, the focus is going to be on the people we are all the most worried about, right? Either because of what they do for work, or because of their age, or because of their physical condition, right? And then, so probably be Q2 before you get to the point where, and again, this presumes everything sort of goes the way people expect it to go. It would probably be Q2 before just Joe Q or Jane Q citizen would have access to a vaccine.
So Q2, spring is what you're saying?
Yeah.
Maybe closer to the spring, you think the general public who are not high risk, or maybe a healthcare worker, for instance?
Or don't work in long-term care, or aren't, right, yes.
So springtime.
Are you considering, or can you issue an executive order to mandate vaccinations? Is that something you consider?
No, the state statute that we operate under is really related to flu vaccines, and especially flu vaccines for students and kids. But we can't, and I don't think we would, mandate in this particular case.
Not even for students?
Pardon me?
Not even for students?
I think, remember, this vaccine is basically for over 18s, right? The reason it's for over 18s is because the under 18s are nowhere near at the same level of risk as everybody else, either to get it or to transmit it.
Governor, the Massachusetts legislature is expected to vote on a wide-ranging policing bill today that includes a lot of things, includes some things that you had proposed yourself,
So the policing bill came out of conference committee, I think, around 5 o'clock yesterday. We're still reviewing it. Obviously, since we filed the first round of creating a certification and decertification process in Massachusetts back in June, this is an issue that's important to us. And as I have said before, you know, until we have a chance to actually read the thing, which, I mean, we haven't even talked to our own lawyers about it yet. I'm not going to comment beyond that to say that I'm glad that the legislature moved forward on this. I'm glad this was something that was part of what they consider to be important to get done before the end of the session. But I can't speak to the specifics of this until we have a chance to review it.
Governor, could I ask you about testing at the colleges? The
Yeah.
repeated testing, how well has that worked? And that could be a model, could it not, for perhaps other businesses, other industries?
So the colleges had a couple things. First of all, we worked with the colleges and with the Broad Institute to make this happen. It didn't happen by accident. And we put $10 million into the Broad to make it possible for them to acquire the equipment that was necessary to deliver a relatively inexpensive, very often done test to the schools. And we also worked with a number of the vendors that the schools brought on to do a lot of their specimen collection work. The thing to remember here is that you're talking 50 or 70 enterprises, schools that participated in this in Massachusetts, that have residential campuses and core centers logistically where they can get kids to show up on the time and place that they're supposed to show up to get the specimen collected and then taken to the Broad and then sent back. There are 351 cities and towns in Massachusetts and millions of households and millions of kids in the K through 12 system for which you don't have the same kind of, first of all, small size to begin with and controlled universe that colleges and universities have with respect to how to do something like this. I do think there are businesses that test their employees on a pretty regular basis right now. And they do so, in many cases, using a variety of vendors and players that are in the testing space. I think the most interesting thing to me about testing right now is this Buy Next Now test. Costs $5. Was deemed to be enormously accurate when put up against a PCR test where we did basically a research project in conjunction with some of the folks on our medical advisory board up in Lawrence. And while it is not yet considered self-administrable, which is the part that really takes a huge part of the logistical challenge out of this, it's not that complicated a process to actually do the nasal swab with this. It's not a deep swab, it's a 5 times around each nostril swab. And then you basically take it and you put it into a sleeve that's in the device, the sort of little booklet that the test comes in. You close the book, and then you wait, and then the result shows up on the back side, and you either get a pink line or a black line, depending upon whether you're positive or negative. The federal government bought up the entire fall production run for that. They bought 150 million of them for $750 million. I happen to think tests like that, made widely available to the public, could have a huge benefit, not just to businesses, but to everybody.
So were the colleges good at it? Has this worked, their repeated testing, do you think?
Oh yeah, I think, look, part of the reason we worked with the Broad and with the colleges to put this together in the first place is we were concerned about a whole bunch of 18 to 21-year-olds who are on their own here in Massachusetts, many from other parts of the country. We wanted to create some sort of structured and an affordable way to test them. And it worked, I think, quite well. And I fully expect that it will be part of the way this process works for kids when they come back after break.
Governor, Representative Dolan suggested that maybe you could deploy the National Guard to help out with more testing to shorten the lines. Is that something that's on your radar?
I think one of the things, first of all, the testing before Thanksgiving, as I think we've talked about, there's a ton of travel-based testing in that. I do want to wait and see what the testing volume looks like post-Thanksgiving before we make the big decisions about how to do things like deploy the Guard. Because I would like to know if, in fact, this was driven by something other than the holiday before we make a big decision like bringing somebody like the Guard into this.
There's another big holiday coming up in 3 weeks.
It's not a travel holiday like Thanksgiving. I think we all know that. The second thing I would say is we do need to sort of reconfigure our testing protocols and the way we're organized to deal with winter, which is really, in some respects, the thing we're primarily interested in at this point.
Governor, you put a plea out before the holiday about unemployment if you're having problems to reach out. Any feedback there, any adjustments being made? It sounds like some of the verification process may be slowing things down for a lot of people from what we've been hearing.
I definitely think on the unemployment piece that the verification process has slowed things down. But that said, it's really important that the folks at DUA get this right. You can't have a system when you have validated information, not just here in Massachusetts, but across the country, that there's a lot of very significant fraud baked into the application process by people who are really sophisticated about how to do this. You have to factor that into the way you make decisions, and you have to check. And so some of the checks they put in place are direct outreach to the employers who are represented on some of these forms as being the employer of record for people who are applying for UI. Sometimes that takes a day or two before the employer gets back to them and lets them know whether or not, in fact, that is somebody who's out of work, or if it's not somebody. In many cases, on the fraud stuff, you discover that they don't even actually work for that employer anymore. That's in fact not somebody that's part of their employee community. And I think, many of these touches absolutely create an unfortunate lag, but it's important for these guys to get this thing right.
Last question, with respect to the business curfews, is that something that you intend to continue throughout the holidays, or can you shed some light on when you might begin to roll those back?
Can you give me a for instance?
Well, just wondering, like the restaurants have shut down by 9:30 now. You mentioned cases were starting to slow today. Like, what metrics do you need to see before you lift some of those restrictions?
Well, we continue to follow. Obviously, the metrics we follow the most closely are the ones that are on that front page. Who's getting infected, what's going on with hospitalizations, what's going on with ICU capacity, and what is our trend with respect to positive testing, both cases and percentages. We currently operate at about 67% of our staff capacity across Massachusetts on the hospital side, and we're at about 50% on the ICU side. And honestly, the biggest difference, there are a lot of differences between the spring and the fall with respect to our healthcare system's ability to manage all this, and they're way better at it now than they were then, and they were good then. The biggest difference is the ICU piece is a much smaller piece of the total hospitalization as a percent than it was in the spring. In the spring, by the time we had 2,000 or 3,000 people in the hospital, we had almost 1,000 people in the ICUs. We currently have roughly 1,000 people, 1,100 people in the hospitals, and we only have 240, I think, in the ICUs. And some of that's a function of the changing nature of who's getting sick, which is driven by the changing nature of who shows up in the new cases every day. But some of it's also driven by the fact that the hospitals have just learned a lot, and the healthcare system's just learned a lot about how to treat people who are dealing with COVID, and in many cases are relying less than they did in the spring on intubation and ICUs as sort of a first resort, because they have other things they can do with respect to some of the steroids that have proven to be enormously effective, and remdesivir and some of the other drugs. And I think that's, for us, that's an important part of how we think about our ability to make sure that we can take care of the people collectively who get sick and need to be in the hospital.
Governor,
the epidemiologists-
you said cases aren't being linked to indoor dining.
Say again?
You said cases aren't being linked to indoor dining so much in the past. So are you considering lifting that curfew for restaurants at some point, especially with outdoor dining pretty much over for them?
Part of the reason for implementing both the gathering limit and the stay-at-home advisory was to limit the amount of time that people were spending in informal settings, and to try and encourage everybody to be home sometime around 10 o'clock. I mean, it was directed at everybody who's open at night. It wasn't just directed at restaurants. And in the case of restaurants, we actually created a modest exception that basically said, if somebody's seated and served, and it's 9:30, that they can finish their meal as long as they're out the door by 10. But our goal here was to send a big message that people need to spend more time at home and to be pretty rigorous and disciplined about what they do when they go out. And I think, you know, it probably helped a little bit with the fact that our trend, which was 5% a day, almost every day in increasing cases, has now flattened out, and for the past 10 days or so has kind of bumbled it around that 2,300, 2,400 mark, even though we had really high testing numbers over that period.
Governor, the epidemiologists who were posed with analyzing the clusters, have they analyzed clusters either related to schools or of school children, be they in or outside school facilities?
I don't know if they've done specific analytics on that or not, but DPH has not found much that's translated into sort of school-based clustering. Do you want to speak to that?
So in terms of the cluster work in particular, as you know, we've done youth hockey, houses of worship, and we have 2 more in the works, or actually about to be finalized, that we're going to be briefing the governor on, and then he'll probably be here to talk about them. In terms of schools, there's been there's been 63 incidents of two or more individuals in a school setting that would result in a cluster, and it's about 112 kids. And if you do that on a base of about I don't know how many people are in schools at the moment, but if I use a base of like 450,000, which I think is actually probably pretty conservative, that's 0.02% of kids or anyone related to a school that'd be related to a cluster. So when you look at the weekly cluster report and you see the numbers, that's sort of how we're doing our cluster investigations on the ones that have the most numbers, that we really want to understand what the potential transmission is.
So that does not include students who are outside of schools, right? Just to clarify, because I know some parents get confused about school transmission versus out-of-school transmission.
So we talk about clusters. So 2 individuals, it's hard sometimes to do where does the actual transmission occur? There have been questions at these press conferences, a child who's been sent to school who tested positive, the transmission is home, right? And those are pretty obvious. But if 2 kids or a kid and a teacher were in a school, it's not, did they create the cluster or did the cluster start somewhere else? So we generally talk about clusters being 2 individuals, not related, and you can tie it to a setting is like a clean way to talk about clusters. Transmission is actually pretty subjective. You have to go all the way back. If I asked everyone in this room, so where were you 7 days ago, 5 or 7 days ago, and can you trace for me every place you've been and where you possibly might have been exposed? That is a highly subjective. So we use the public health definition of 2 individuals and a setting, and they're not related.
Thanks, everyone.
Come on, Bruce, you're sitting there waiting.
You do a really good job of explaining what's happening with cases and how they've been going up and what's happening with them. you don't do the same sort of analysis with deaths. What's your assessment of, because they seem to me to be low to flat relative to
They
the
are.
spring,
They are.
which is a good thing, but you don't talk about it hardly at all. Why is that?
We could probably put together something on that. We do, I mean, obviously, we track deaths, and we track
But is there a percentage,
filings on them and all the rest.
something like that? Like deaths divided by tests or something like, I don't know. You have all these measurements for cases, but almost nothing for deaths.
We talk about how to think about it a lot. I'll huddle with Mary Lou and the Command Center folks to figure out some way to talk about it. What you really want what you want is how to think about it in the context of the growth in cases, the growth in hospitalizations, and the presence of the virus generally.
Yeah, and a lot of young people are sort of saying, man, if I get sick, it's not a big deal. But the big problem is that people start dying, and they sort of, a lot of them sort of say they're not dying in great numbers, so it's not that big of a deal.
Yeah, the single biggest issue that young people need to understand is slight symptoms or no symptoms. And the fact that, somebody in their 20s or 30s who is in fact contagious and who has the virus but is showing either really light symptoms or no symptoms is perfectly capable of giving that to their parents or giving it to an uncle or giving it to a grandparent. And that also makes, by the way, some of the issues around contact tracing complicated, because if people aren't actually aware that they have the virus and they aren't showing any symptoms, and somebody like a mom or a dad or a grandfather or a grandmother gets the virus, well, who you been with, it gets a little complicated sometimes to try and track it all back. And the thing I've said about young folks generally is this thing is a silent spread in many cases. And because it is a silent spread, you can pass it along to a lot of other people without necessarily knowing you're doing it. And for them, it may be a life-altering event. And I think, and I guess what I would say, Bruce, is I don't buy the idea that the only way young people should think about this is in terms of the fact that, it's only, to sort of frame it the way you're framing it, 25 people a day. It's still 25 people a day, and it's still many people who end up in the hospital, and many of the people who end up in the hospital make it primarily because the hospital and the people who work there have gotten a heck of a lot smarter about how to treat this than they were when it happened in the spring. And the last thing we should be thinking about this is that somehow it's not my problem, okay? I mean, I think we should all think about this as a problem for us all. And I can't tell you how many people I've talked to since the beginning of this who at some point in a really sad and difficult conversation with me has said something like, I never thought this would happen to us, right? I never thought we would be the ones who were dealing with this. And that's like the most important point of all here, which is that this is not, when you have community transmission, when you have something that's as contagious as this is, all the hard work that so many people in Massachusetts have done with masks and distancing and all the rest has had a profoundly positive impact on our ability in Massachusetts to do a lot of things we care about. But the last thing anybody should do here is just sort of say, well, it's nowhere near as bad as it was, or it doesn't seem as bad as it was, because it's exactly that kind of attitude that will lead to the letting down of the guard and the informal behavior that creates the biggest and most significant issues associated with spread, period.
Thanks, everyone.
Thanks.
Thank you.